Good evening, everybody. We now have 647 confirmed cases. Good evening, everybody. Sorry about that. We have 647 confirmed cases of the China Wuhan virus. That's kind of what it's been dubbed. And it's a coronavirus. At Wuhan, China, currently they do have a complete travel ban and mandatory quarantine. Right now, there's a second city in China getting ready to go under quarantine that borders Wuhan, kind of similar to Seattle and Tacoma, like we have here in Washington State. But one of the things that I wanted to show all you tonight was the latest press conference about the virus. So I'm going to put on the press conference. It's about, I think it's 30 minutes long. And we'll get the latest updates about the virus that way. So let's get the press conference started.
We'll just keep it short. For those online who would like to ask questions, please dial 01 on your keypad and you will be put in the queue. As we have announced earlier, and you have a nameplates here with us, we have Dr. Tedros, WHO Director General, Professor Didier Houssin, who is chair of the emergency committee. We have Dr. Mike Ryan, and we have Dr. Maria Van Kerkhove from Department of Diseases and Zoonosis Unit. Mike Ryan is the head of emergencies at WHO. You know, today was the first meeting of the emergency committee under international health regulations on novel coronavirus, and I will give the floor immediately to Dr. Tedros.
Thank you, Tariq. And good evening to everyone in the room and everyone online. We're really sorry that we're late, but thank you all for your patience. As you know, this is an evolving and complex situation. And I would like to thank Dr. Houssin for his leadership of the emergency committee and all members of the committee, the advisors, and those who made presentations earlier today during the deliberation. I was very impressed by the detail and depth of China's presentation. I also appreciate the cooperation of China's Minister of Health, who I have spoken with directly during the last few days and weeks. His leadership and the intervention of President Xi and Premier Li have been invaluable, and I know you're following the actions they are taking. All the measures they have taken to respond to the outbreak. Today, there was an excellent discussion during committee meeting, but it was also clear that to proceed, we need more information. For that reason, I have decided to ask the emergency committee to meet again tomorrow to continue their discussion. And the chair, Dr. Houssin, has agreed with that request. The decision about whether or not to declare a public health emergency of international concern is one I take extremely seriously, and one I'm only prepared to make with appropriate consideration of all the evidence. Our team is on the ground in China as we speak, working with local experts and officials to investigate the outbreak and get more information. We will have much more to say tomorrow, and thank you very much, and we'll be glad to answer any questions you have. But before that, I will give a chance to the chair, Dr. Usa, to say a few words, and after that, Mike to have to say on the actions we have recommended. Thank you.
Thank you very much, Dr. Tedros, and thank you for you all to be present this evening. It's true that the committee met during several hours today. We heard very interesting reports from the Republic of China about the situation in China. We also heard reports about the situation in Japan, in Thailand, and in Korea. Following this, we had also the analysis of the situation made by WHO Secretariat, and then we entered into a discussion about important advice to provide to the DG of WHO. That is the situation corresponding to a public health emergency of international concern, and what advices should be given to the DG. The views of the members of the committee, considering the information provided, was split about the opportunity to advise the creation, the decision of a fake. But we formulated a series of recommendations concerning the improvement of containment and mitigation measures, which are already important in China, and also about the measure that should be taken by member states. One of these measures is the improvement of sharing of information and cooperation between member states in such a situation. One of our advices was to suggest to the DG that the emergency committee should be reconvened very early if necessary. And in fact, the situation is evolving rapidly, as said Dr. Tedros. And for this reason, we, of course, agree completely with his decision to reconvene the committee tomorrow, considering the evolution of the situation and the measures taken not noticeably in China. Thank you.
Dr. Ryan?
Good evening, everyone, and let me again thank our member states for their excellent presentations today at the Emergency Committee, and also for their actions already taken in the face of this evolving epidemic. Just to briefly summarise to you that WHO has been on full activation of our incident management system since the last day of 2019 across the three levels of our organisation. We've been coordinating a series of global expert networks and partners.
Now, just to be clear about one thing, in this press conference, they're calling this an epidemic, but anything over 600 is considered a pandemic. So he's a little bit wrong on his facts there. It's just a little bit older of a press conference. It was about 6 hours ago. So the numbers may have went up since the time of the press conference, but it is no longer an epidemic. It is now considered a pandemic.
Partnerships that have dealt with laboratory diagnostic, assay development, infection prevention and control, clinical management, standardized data collection, mathematical modeling, research and development, and many other pillars of the response. We've been providing technical support to member states, both member states affected and unaffected states. We've been sharing critical updates with member states through our EIS platform with member states with disease outbreak news and through the WHO website. We have released a comprehensive technical package of interim guidance for 2019 nCoV. These materials are online, reviewed daily and updated regularly. We have updated travel advice for international travel and health in relation to the outbreak. In addition, we have been working very, very closely with global partners and the Global Coordination Mechanism for Research and Development for Epidemic Diseases as part of the Research and Development Blueprint, working with institutions such as CEPI and others on advancing medical interventions, diagnostics, therapeutics and vaccines. And at the moment, the landscapes analysis for those have been completed. We're working on sample and virus sharing. We're working on developing and disseminating clinical trial protocols and many other issues related to the carrying out of structured evidence-based research in the field as needed. The priorities right now, notwithstanding the deliberations of the committee, the member states affected have implemented a number of control measures. These have focused, and WHO agrees. The primary issue is to limit human-to-human transmission, to reduce secondary infections, especially amongst close contact and particularly in healthcare environments. We need to prevent transmission through amplification events and super spreading events, and obviously prevent further international spread. Reducing zoonotic transmission or transmission from animals to humans is important, and identifying the animal source or sources and limiting exposure to those sources is exceptionally important. We need all member states to focus on early identification and isolation of suspect cases and probable and confirmed cases, and we are working closely to equip countries to be able to detect and isolate and provide optimized standards of care. There are many unknowns to address in this event, including clinical severity and the true extent and nature of disease transmission. Communicating critical risk and event information to all communities is the responsibility of everybody, our member states, the media and WHO, and we at this time must particularly counter misinformation that may affect people's behaviour. And lastly, minimising social and economic impact is important at this time. So the organisation is fully activated at all levels with our partners in response to this event, and we await the further deliberations tomorrow of the committee as I say, we await those deliberations.
Thank you very much. Before we go to questions, first I have to apologize to Dr. Sylvie Briand, who is sitting next to Dr. Mike Ryan. Dr. Briand is our Director of Global Infectious Hazard and Preparedness, and she, together with Maria, may answer some of your questions. So we will start with the questions from the room. For those online, I will just repeat that if you have a question, please type 01 on your keypad and you will be put in line. We will take questions if our speakers agree one by one, and I will ask you to introduce yourself first and the outlet you are working with. So we will start with, I think, colleague from China.
I'm a journalist from CCTV. My question is to Your Excellency, Mr. Director General, Dr. Tedros, about WHO's evaluation of the measurements by the Chinese government in response to the epidemic. After the outbreak of 2019 novel coronavirus epidemic, how do you comment on the liaison and reporting between the Chinese government and relevant departments with WHO? With your expert group already in China, what evaluation does WHO have on Chinese medical institutions regarding outbreak control and patients' treatments? Thank you.
Playing a press conference.
Yeah, thank you. Of course, this is a novel coronavirus, and it's a new discovery. So identifying the pathogen was done swiftly, and it shows the capacity that China has now. And the sequencing was done quickly, but more importantly, it was shared immediately. And that's why Korea, Japan, Thailand were able to diagnose the new coronavirus quickly. In addition to that, actions taken immediately, especially on the market, the Wuhan market, seafood market, and followed by other actions was very commendable. And the involvement of the leadership, starting from the president himself, who gave really clear guidance, the premier and the minister, was also very impressive and different actually from previously, from previous actions. You see the capacity and you see the political commitment. And that's continuing, and we appreciate that. But at the same time, although there is good capacity in China, they have also invited our experts. So our experts are now on the ground as we speak with Chinese experts assessing the situation, and that's why we're saying we will have more information and we will reconvene tomorrow.
Okay, that pretty much summed it up with the press conference. There was just a little Q&A after that, and most of it is in Chinese. So if we go to Flight Tracker 24, we can see, so Wuhan International Airport. And as you can see, they have shut down completely. There is nothing in the airspace right now headed to or from the airport. Go over here to arrivals. Yeah, see everything. Canceled, 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 canceled. Oh, wait a minute. Scheduled, scheduled. It looks like they might be reopening the airport pretty soon. But no, because after the schedule, you go down to canceled. So maybe they're just limiting some of the traffic coming in and out of the airport. Look at departures. Canceled, canceled. Scheduled, right here, scheduled, scheduled. Scheduled. Canceled, scheduled. Scheduled, scheduled, scheduled. So apparently, this isn't as much of a lockdown as they're saying it is. But if we go to on the ground, yeah, see, we got a lot of planes waiting for clearance. No, is that going to Wuhan right there? Yeah, see, all these flights are being diverted. They were originally supposed to be going to Wuhan, but they're going to other places. We have some going to Shanghai now. Interesting. And we look at what goes on Twitter, it looks like they're actually decontaminating the streets of China right now. Or the streets of Wuhan, rather. This is an interesting video. Here's to show people in public in, is this Wuhan or what province is this in? Oh, this is in Singapore and Japan. It's showing affected people in public. And as you can tell, medics that are responding to these calls are in full hazmat gear. Here's a video in Wuhan of people in a grocery store fighting over food. So I'm wondering if the quarantine of Wuhan right now, if they're not even letting people in to restock shelves, the truckers. Because I haven't seen anything as far as the extent of the lockdown. But it's interesting right now. They're saying that there's 647 confirmed cases of what they're calling the Wuhan virus now. But if you take a look back when the SARS outbreak happened, they were reporting a few hundred people. And then before you know it, all of a sudden there was a global pandemic and there were thousands of people. So the Chinese government has a history of underreporting the severity of things. So you got to keep that in mind too. Oh, and now it says right here, just updated 16 minutes ago. The official count is now at 800 with 25 confirmed dead. Now, is that the global count or is that just the count in China? And see, the United States isn't even restricting people going to China. It just says it's in a level 2 travel advisory. All right, so here's the numbers that they're reporting. They say mainland China 639, Taiwan 2, Hong Kong 2, Vietnam 2, Thailand 3, Japan 1, South Korea 1, Singapore 1, and the United States 1. Now those are just confirmed cases. The actual numbers are probably much, much higher than that. Wait a minute. Even if you add that up, that doesn't come to 800. So there's something wrong with the reporting there. So we have 2 confirmed cases in Hong Kong now. So if we go back to Twitter, see if we can see any updates there from reliable sources out of China. Oh, there you go, in case you haven't seen this before. Here are some of the symptoms of this new coronavirus. Fever, chest pain, chills, rapid heartbeat, difficulty breathing, pneumonia, kidney failure, headache, sore throat, cough, shortness of breath. So take that for what it's worth. And then if we look at a global map here of see, now this has to be vastly underreported right now. Because there's no way, with China being that close to Hong Kong, that there's only 2 cases. I mean, that's like the United States and Canada. I am not believing that report at all. But again, we go over here to Flight Tracker, and so far, they have grounded everything. You go to Wuhan. and there's nothing going in and out of there. Yeah, I agree. You really can't trust what mainstream media is saying right now. They're not accurate with reporting on this story, that's for sure. But then again, they don't want the masses to panic and think the world's coming to an end, although it probably is. College student in Texas quarantined with suspected coronavirus case. So would this be a second confirmed case in the United States? Yeah, see, this is still saying that 17 people have died. And in another report, we've seen that at least 25 people were confirmed dead. So we're definitely getting conflicting reports. A Texas A&M student. When was this released? This was about 1:56 p.m. So that was a few hours ago. So I'm thinking that did not test positive. Otherwise, they'd be all over the media now. And that's the only report of a possible second case in the United States. So yeah, we've got 2 cities in China on lockdown now. And Wuhan is bigger than any U.S. city in and of itself. And the second city, I believe, is about the size of Los Angeles. So it's kind of crazy there. Yeah, I wouldn't believe the locals have been locking up infected. Probably putting them in concentration camps and not reporting the numbers. See, and a lot of this is just old stories right now. China contends with questions over response to viral outbreak. Yeah, because their response was too little too late. Death toll now includes first death outside epicenter of outbreak. Yeah, fine, we'll disable the ad blocker. Militant member uses thermometer gun to see, so they're actually still letting people in and out of Wuhan, and they've got their own transportation. It's just you cannot take public transportation and leave. So I mean, that kind of defeats a lot of the purpose. So the official death toll is now 25, with 830 being confirmed infected. So literally, this number is going up every 15 minutes. Yeah, the size of the lockdown going on in China right now is the equivalent to New York, Los Angeles, and Chicago being put down on lockdown at the same time. Yeah, exactly. I agree with you. In the capital, Beijing, officials canceled major events indefinitely. Chinese officials have not said how long the scheduled shutdown will last. Well, you'd think it would last as long as the pandemic was going. Okay, well, there's no major news updates, and there's probably not going to be for what time is it in Wuhan right now. Currently 9:23 a.m. in Wuhan, China. So there's probably not going to be any major updates until I'd say 5 or 6 Wuhan time. So I'll probably come back on the air then. So I'm going to wrap up this stream for now. Thanks for watching, and I will see you back later.